Yeah, my name's David Baird. I am the Chief Executive Officer of Gurriny Yealamucka Health Services, which is in Yarrabah, an Aboriginal community near Cairns. We have partnerships in place, and one of the delegates just made a mention about Nicola Roxon saying that community control needs to be responsible. Well, we community control have been, fulfilling their responsibilities. I guess there is some work that needs to be done in terms of how we fine-tune the work that we do within our services, but also together, collectively, within our regions. But I guess in terms of how the whole Aboriginal health sector moves forward as well, we're becoming more professional. I guess there's a lot more to deal with in terms of structure and systems today. There's a move towards mainstream. I see that as a good thing in terms of how we engage our community to be part of that, and that will actually lend itself to employment. You would hope, things like having consultants come and work with us, or maybe, if we even start to look at Aboriginal consultants or something like that, but a health service is more than just providing better health service, or more than just partnering with state health or other health service providers. Is about how we engage the whole community and how the whole community engage with each other to bring about real change. So, and from that side of it, I'm sort of looking at, well, what's the links here between our developments and social health determinants, and making a change with social health determinants through empowering the community through employment, training, and things like that. Yeah, success, I don't know. Look, I've been there 3 years as a CEO of Gurriny. Previous to that, I spent 10 years in the Alcohol and Drug Rehab Centre. And I'm reminded of the constant battle to, you provide a service for the community takes part in it, in programs. You give them knowledge, you assist them with certain things, but then you still have to deal with all the environmental stuff, and I think largely the symposium here, the main theme here is the social determinants. So how do we engage with other sectors, housing, employment, education, things like that, so that what we're doing is not just seen as in silo, or we're struggling to do by ourselves. The 3 years that I have been at Gurriny have been really good. There have been significant development there. There's only 8 staff when I first started there in 2005, and we've got a staff of 30 now. We revived a partnership, more than just, revive how we negotiate with government departments, but I think that the partnership, when it was set up, and the partnership framework, all it really did was just got people to agree to work together, but we didn't have any structural support or resources to see that happen, or to take the next step and actually take our health developments further. Still there's an underspend, still we're under-resourced in terms of when we have a look at what our needs are, or the level of needs are. And we need, as we heard today in the opening address, we need a lot more investment in this other end, social determinants or the socio-economic factors. Success, yes. I guess Gurriny as an organisation, we could say we're successful in moving forward. We're successful in embracing the partnership. We're successful in getting the governments to try and work to us better or more collaboratively. That if whatever policies or whatever negotiations or discussions is happening at this level, the state or regional level, then that needs to be articulated back down on the ground. Because take Queensland Health, for instance, they may make decisions or have discussions with us at a policy funding level, but the people on the ground that we work with don't know about it, and then that creates barriers for us. So there's constantly there's barriers there, and constantly there's challenges there. It's a dogfight every day, really. Don't want to sound pessimistic. Things are happening, but they could happen better, or they could happen much quicker, I believe. And I think that the governments, what they need to do is just put a bit more money into their rhetoric, basically, Otherwise, it's just that. It's just rhetoric. Research is needed. We need to identify, what we're dealing with. We need to identify or try and unravel the mess that we're in, because what we're dealing with is, intergenerational. The stuff that we're dealing with today just didn't happen yesterday. So I'm reminded of, I guess, my own community where I live, and we do have the extended family systems there, and you will get other races who have that too, and they use it to their benefit or to their advantage. Like immigrants that come over from other countries, they come over poor, but they end up really well off because they're able to work together as a family and family groups. We do the opposite. We don't really support each other that well. You see children being neglected. You see where there's violence, family violence, or someone not being responsible, and then you can't leave them because you're related. You have to try and help them. So you pick up the pieces, and then it's an extra burden on you. And then if I got pressure at home, and then I take that to work, then that affects my work performance as well. And so research, absolutely, we're going to, it gives us, that place where we could have a look at historically what's happened to Aboriginal people. So the dismantling and the destruction of, I guess, the structures of Aboriginal culture and family and what held it together. And today, we can use, what are the good stuff from Aboriginal culture, what are good stuff from, other cultures to try and bring us together. And when we do that systematically through research, and we can say to the governments, well, we want you to come on board, but we want you to listen, but not only listen, we want you to trust and have faith that we can do this, but that also allow us to make the mistakes. How much mistakes have been done in the past by mainstream, by government departments? As soon as we muck up once or twice, then it's another reform. But we can do it, and I think that we need to get fair income. I think the one area of responsibility for me, and not taking away from the hard work that has been done by our brothers and sisters in the past, is that we can lead by example. And the life I live, people are going to watch that, people are looking. So I need to make sure that if I'm talking about health improvement and health developments, then I need to make sure my life is part of that and not part of what's opposite. So Noel Pearson would say you either be part of the problem or you'll be part of the solution. What you say, back it up. And I think that's where we can be a bit more responsible, show a bit more responsibility. You get a lot of health workers and even nurses, even health professionals, people who smoke cigarettes, people who gamble, people who drink. So how can you preach about good health and better health if you're doing something that's detrimental to your health, physically or psychologically, things like that, yeah.